Necrosis. In this video, we'll discuss the definition, morphology, and types with example. Necrosis is basically cell death. How does the cell death occur? So cells do contain lysosomes, and at times these lysosomes they can give out certain enzymes, and these enzymes will devour the contents of the cell. Here the lysosome is releasing enzyme, that Pac-Man is the enzyme which is devouring the contents of the cells. Also, inflammation caused due to cell injury can result in the release of lymphocytes, and these lymphocytes can again lead to cell death. So necrosis is nothing but cell death, which is associated with loss of membrane integrity and leakage of cellular contents. How does this occur? It occurs from degradative action of enzymes on lethally injured cells. Now, the enzymes responsible for digestion of cell may be derived from lysosomes of dying cells or leukocytes that are recruited as a part of inflammation. Morphological changes can occur in necrosis. There will be cytoplasmic and nuclear changes. What are the changes in cytoplasm? Increase eosinophilia, that is, eosin stain will be bound more to the denatured cytoplasmic protein, and the cells will have glassy homogeneous appearance due to loss of glycogen. Also, they are going to have a moth-eaten appearance. Why? Because all the contents are devoured and there will be large vacuoles which will be formed. Thus, moth-eaten appearance. This is a classic feature in necrosis. Moving on to the nuclear changes. Nuclear changes occur due to breakage of DNA and chromatin. Three main nuclear changes can happen: pycnosis, karyolysis, and karyorrhexis. Pycnosis is the nuclear shrinkage, that is, DNA condenses into shrunken basophilic mass. Karyolysis is nuclear fading. Here, chromatin dissolution occurs and fading happens, and karyorrhexis is nuclear fragmentation, that is, pycnotic nuclei membrane will rupture and nucleus undergo fragmentation. So these are the nuclear changes. Next, what happens to the necrotic cells? Either they persist or they get digested. The dead cells will be replaced by myelin figures, and these myelin figures will be phagocytosed or degraded to fatty acids, and dead cells can also calcify. Moving on to the types, here is the mnemonic. Fun-filled life can get complicated. Fun for fat necrosis, fill for fibrinoid necrosis, life for liquefactive necrosis, can for coagulative necrosis, get for gangrenous, and complicated for caseous necrosis. Starting with fat necrosis. Fat necrosis refers to focal area of fat destruction. I'm giving the example of pancreatitis. What happens is, during pancreatitis, there is release of activated pancreatic lipases to the pancreas and the substance of the pancreas and the peritoneal cavity. What these enzymes do, they liquefy the membranes of fat cells in peritoneum. In the peritoneum, there will be fat cells, and these fat cells, their membrane will be liquefied by these pancreatic lipases, and they split the triglyceride esters contained within the fat cells. Also, they split the triglyceride esters within the fat cells. Again, these fatty acids, they'll combine with calcium, and thus they'll produce a chalky white appearance that is called fat saponification. And when we are examining histologically, we can see foci of necrosis containing shadowy outlines of necrotic fat cells with basophilic calcium deposits surrounded by inflammatory reaction. So there will be these fat cells which has undergone necrosis with some calcium deposits and will be surrounded by inflammatory reaction. Next is the fibrinoid necrosis. Here it is usually in immune reactions, that is, antigens and antibody complexes, they get deposit on the walls of arteries, and when stained they appear bright pink and amorphous in nature, and the preparations are called fibrinoid, and immunologically mediated diseases are example. Okay, That is the condition where this fibrinoid necrosis can be seen. So this is immunologically mediated. An example is polyarthritis nodosa. Don't forget that. This is the example for fibrinoid necrosis, which is occurring in the walls of an artery. Next is liquefactive necrosis. This is commonly seen in bacterial or fungal infections. Why? Because there will be microbes. So, what these microbes do, they stimulate the accumulation of inflammatory cells. Inflammatory cells, I told you in the beginning, will result in release of leukocytes, and leukocytes release the enzymes to digest the tissue or liquefy the tissue. So the hypoxic death of cells within the central nervous system often evokes liquefactive necrosis. Thus, dead cells will be completely digested and will be transformed into a liquid viscous mass. And this digested tissue is removed by phagocytes. If the process was initiated by acute inflammation, like bacterial infection, then it will lead to pus formation. This is liquefactive necrosis. Moving on to coagulative necrosis. Here, the underlying tissue is preserved for many days. Why? Because the injury, it denatures not only the structural proteins but also the enzymes. Thereby, it blocks the proteolysis of dead cells. So, the eosinophilic enucleate cells will persist for days or weeks. And these leukocytes are recruited to the site of necrosis, and dead cells are digested by the action of those lysosomal enzymes. Okay, and this is characteristic of infarcts in all of solid organs. This is an example. Gangrenous necrosis. It is not exactly a distinctive pattern of cell death. It is usually a condition of a limb, generally lower leg, that has lost its blood supply and has undergone coagulative necrosis, involving many tissue layers. Now, when bacterial infection is superimposed, this coagulative necrosis will be modified. I told you before, bacterial infection, such infections can lead to liquefactive necrosis. So when bacterial infection along with this coagulative necrosis occur, then liquefaction happens, that is leukocytes come in action, and thus wet gangrene is formed. Here is a picture of gangrenous necrosis. Next is caseous necrosis. As the name says, it is cheese-like. Cheese-like, usually seen in the foci of tuberculous infection. So, in microscopic examination, we can see this granular pink appearance, and also there will be a yellow-white appearance in the area of necrosis, generally when we are looking. Unlike coagulative necrosis, here the tissue architecture is obliterated. We cannot see any cellular outlines. Area of caseous necrosis is often enclosed with the inflammatory border. So thus the focus of inflammation is known as a granuloma. Okay, so that is about caseous necrosis, and here is the picture of a caseous necrosis, cheese-like appearance. Reference is from Robin's book of basic pathology. If you want, you can read that. And question can be define necrosis and describe different types with examples. And all the necrosis I have explained with examples. So make sure you're citing every example wherever possible. Don't forget to like, share, comment, and save this video for future reference. Thank you for watching.